A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast, and today I'm joined by someone that actually their name has come up quite a lot in this industry. You know, I've been involved in PEMFs now for over 10 years, and you know, someone that we really wanted to get on this podcast is Dr. Robert Dennis, and his connections with the whole NASA studies. And because that's something that, especially when people are new to PEMFs, they start looking into PEMFs, NASA comes up quite a lot because I was talking to Bob just before this, Rob, also known as Bob, before this podcast, and he was talking to us about how the connection of PEMF and NASA all started. So we'll get into that and we'll get into the nub of it. But can you introduce yourself, please, Dr. Robert Dennis? And I know you've kind of collected a few PhDs over your time, so just mention what you've been doing.
Yeah, I do basic research. I did my PhD in a laboratory, in a physiology laboratory, actually, at the University of Michigan. But I'm a biomedical engineer, so I approach biology from very technical side of how do you build instruments to measure and quantify physiologic signals. And that's sort of like my research background. And I did research on physiology for my PhD. For 20 years or so, I did tissue engineering research. You know, how do you build a tissue or an organ in a petri dish in culture, and quantifying that and everything. And so, but I've done a lot of other work on the side. I just helped my wife finish her PhD. She's going to graduate in 2 days with a PhD in biotextiles, and she and I developed a whole new sort of class of materials for growing tissues on. It's a composite foam. And so I've helped a lot of different people. I've been involved directly, really deeply in about probably 10 different research areas, sort of peripherally related. But I do a lot of consulting as well on the side. So outside the university, run my own company, MicroPulse, which probably I'm sure you've heard of. And so, yeah, I had this terrible back injury. I was in the United States. A big thing is volunteer firefighting. 3/4 of the firefighters in the United States, 75%, are volunteers. So we go through the same training as a career firefighter would. So we just don't get paid, right? So I had a bad back injury that had exacerbated earlier injuries on a fire response, and this was about 20 years ago. And I found myself basically crippled with this back pain that was untreatable. So that's what kind of brought me back into this, because I had previously, about 10 years before that, I had done this NASA research that you're referring to. But I had no idea until I kind of put the two together, chronic pain and this basic cellular gene expression research I did for, with NASA as a consultant. I had no idea that the two would go together. So, I kind of came into this whole field of PEMF with this no expectations. It's just I kept stumbling over it, and
So that's a good point to mention, actually, because a lot of people come into PEMF through the back pain route. They have a pain, then they find PEMF through one way or another. But and it was a question I wanted to ask you: was what came first? So the NASA stuff for you was the first experience with PEMF. So what was your first ever mention of PEMF? Was that from the consulting work you did with NASA, or?
Actually, it's let me that's a great question, because it kept coming up like peripherally. So in the early 1990s, I would run into PEMF called different things, like PMF or TVEMF or something, every now and then on a paper, because my PhD had to do with electrically exciting muscle tissue to get it to contract, and then looking at where the proteins went and everything. so I would occasionally run into it, and I would think, oh, this is kind of kooky, people talking about magnetism having an effect on cells. And, I was young. And so I remember being 20. So I knew everything when I was in my 20s. I don't know about you, but I knew everything. And I knew that was a bunch of nonsense. And so I never paid much attention to it, right? Because it didn't fit into my universal view of legitimate science. And then I got my PhD in the early, after having done all this research. When you get your PhD, one of the pieces of baggages you carry off the plane is having read hundreds or thousands of papers. And so one of my colleagues, her name is Kathy Clark, she happened to be the senior visiting scientist on the International Space Station. So that was the NASA connection. She's down the hall. We had shared a few students. I'd helped her with a little bit of her research. And she said, hey, Bob, these guys at NASA are trying to figure out how to use electromagnetism to make cells grow better in low gravity, zero gravity. And they actually call it microgravity. And I was like, okay, well, maybe I can help them, thinking it was going to be an electrical stimulation thing, right? So I ended up flying down to NASA, and they proposed that we use these magnetic fields to grow cells. And I was like, this was 1996. And I said, this is nonsense. And so I went through this whole thing, and we can talk about it if you want, where I forced them to really do this as a well-controlled double-blind study so that we would know if something worked. And we would also know if it didn't work, because my goal was to prove that it was nonsense, to say, okay, we did a careful study. We did everything we could, and it didn't work. And so that kind of came to fruition in 1998 by proving that I was wrong, that in fact there was a very strong effect. If you use the right kind of pulse, the right kind of way on cells, they actually changes their gene expression. Okay, boom, bang. Okay, I didn't believe it the first time we saw it, so I kind of took the instruments back, rebuilt them, handed them back to NASA, and they did it again. In the interim, I had read 660 papers related to PEMF that led up to this work. And I was like, this is the most pathetic body of science I've ever seen. I estimated at most 3% of those papers were any good. And I come from it on the side of, a strict traditional conservative scientist who needs to have the boxes checked off. Did you calibrate your instruments? Are you measuring a number that someone else can measure and repeat? Just simple things like that. And just on the basis of those, I thought, at best, 3% of this body of literature has any value at all scientifically. So 97% of it is nonsense. So I was shocked to see there was an effect. And that was in the late 90s. And then we can get into this, I kind of set it down for a while and was doing my other research. And I was big into research with the Department of Defense here in the United States, working on actually different ways to help rebuild people, prosthetics, and nerve interface stuff, until I ended up injuring myself about 9 years later, probably 2005. And then I thought, well, I should take this. I was so desperate to get something to relieve the pain. I ended up dusting off some old PEMF stuff, tried it, and shocked me that it actually worked where nothing else had. But we can get into the details of that if you're interested. But that was the sequence. It was like, heard about it, did the NASA research 96 to 98, went away from it, came back to it when I needed it in 2005.
No, it's good. And like I say, a lot of people come in the other way around in terms of they're desperate, they're trying to find something, they find PEMF, they have an amazing effect for it. But something you said to me off air, which you mentioned in there was really useful, that a lot of the studies are done where people are trying to prove that PEMF is working, or, like I've developed a PEMF device, you've developed a PEMF device. When we give them devices to people, we're giving them to them on the understanding that we want to have a positive outcome, So a lot of the time that these studies are done, there's like a push for a good outcome. But you went on this completely the other way around. You went in there as a complete skeptic, and you actually went in there to say, no, this stuff is rubbish. move on to something else.
Mm-hmm.
And yeah, if you can just explain that in terms of like, how was your mind changed?
Oh, absolutely. I think that's the most important thing because, I try to fight my own mental biases. And if I really believe something's true, I'm just like anybody else. I get confirmation bias, right? Okay. Yeah, there we go. Right. And you can see people swirling down into these, echo chambers where they just keep, they block out other signals. They just keep confirming and reinforcing their beliefs. Right. So at the time, my belief, and I no longer I'm going to, harbor this, because you learn lessons as you get older, and hopefully you learn enough that you're not an idiot by the time you get to be my age. In fact, I just turned 61. So in case anyone's interested, I've been around the block.
Good for it.
Well, thanks. I've felt better, but I was a firefighter 20 years ago and knocking down doors and stuff. But the thing is that when Kathy asked me to talk to the guys at NASA, they were sort of like the management level people were sort of like, yeah, there's these kind of kooky guys. They didn't put it this way, but and they really keep saying there's something to this and we don't see it. Maybe you can go and help them. And I was like, so even the administration at NASA, the guys who were, sort of middle management, they weren't psyched about it. I don't think I've ever told anybody about that, but that's the fact. I said, well, I can go in as a consultant and, and at the time I was a research scientist at University of Michigan. I was like, yeah, I can do that as a consultant, go in and see what they want to do and try to help them. And when I went there, they were heavily biased towards, PEMF just works. And here's, we think the magic frequency is 10 hertz. And I was like, oh, magic frequency. Well, oh yeah, does something, resonates with something, harmony. They had read, they drank the Kool-Aid, as we say, or as we used to say 20 years ago, when people remember what that referred to. And they believed it. And I had looked at some of these papers and I was like, they're not very impressive papers. So before I worked for them, I actually said, you need to let me review the literature here. Tell me what you're reading and let me review that. Let me do a broader search of all the literature, because University of Michigan is an excellent medical research. So they at the time, this is before Google existed, right? They would do translations for you. So, turns out that about half of the research in PEMF was done by Soviet Eastern Bloc countries. So a lot of it was just completely impenetrable, right, to the average reader. I thought, well, maybe there's something in that. So I had a bunch of these papers translated at the time, collected 660, concluded that only 3% were any good. A couple of them showed maybe positive results, but not really strong. But I'm talking about in terms of scientific, credibility. Was it done well enough that you could conclude anything, positive or negative? So that's how I came into it, was thinking, this is really bad stuff, and I really don't want to do this. The thing I learned as I was looking it up is that it has a stigma associated with it. And I kind of knew this, but going into it, it's like I had many of my colleagues going, you're not going to study that, are you? I mean, two of the people on my doctoral committee who are friends of mine, they're like, you don't want to study that. It's like, you'll never scrub that off, the stain of that off of your academic record if you start publishing on this rubbish. So it wasn't just me. It was a really, really strong bias against it, baked into the scientific apparatus.
Why do you think that is? Is it because the mention of magnets and Earth, and or what? What do you think was driving that?
So I think it was a combination of things. Scientific community. It's sort of like saying the community of cats or something, that herding cats, right? So there's no cohesive scientific. Anybody who tells you there's a cohesive scientific community that is uniformly trying to feed you disinformation, that's disinformation from a different entity that's otherwise engaged right now. But there's so much discord within the scientific community, right? But people who manage it, or people who are at a high level, the higher you go in the scientific hierarchy, the more mainstream your ideas have to be, because you have to pass muster with your peers so many times that, if they think you're a kook, they're not going to invest in you. They're not going to give you one of these coveted positions at a university. I've applied for 2 different university positions in my entire life. And the first one, there were 147 other applicants. And then there was over 150 when I was at UNC, and they had actually invited me to apply where I am currently. So the thing is that it's extremely hard to get one of these positions. And they're not going, people don't want to hire people who are viewed negatively. And this is true in like the clinical sciences and everything, like medical doctors who deviate from the sort of the belief system that's in place. They don't do well. They don't do well. It's not just a question of licensure. So where did this all start? Well, in 1911 in the United States, there was this guy named Flexner, Flexner. And he was paid by Andrew Carnegie to go around and, assess the state of medicine at the time. And there was all kinds of, in 1911, there was 1910 and before that, there was all kinds of different ways of approaching medicine. Energy medicine, allopathic medicine, chiropractic, and so forth. And they basically stigmatized anything that was not, a drug-based allopathic medical model. And there's been this very, very strong bias against anything like that. And it's kind of like this self-fulfilling prophecy. And it starts off with, the use of electromagnetism is BS. And there's nothing to it. Only an idiot would do it. And there's no proof of it. So you want grant funding to see if you can prove it? No. Right. So what they do is they say, you can't prove it because we won't give you money to study it, to prove it. And in science, of course, you don't prove things. What you do is you disprove them. And then you build up a strong inference that you believe something to be true because you've been testing it. You've been testing the hypothesis, and then you sort of back your way into it, which is kind of what I accidentally did getting into PEMF. I'd like to say I'm, the smart scientist who figured out the right way to approach, but I'm not. I kept trying to say this is nonsense, and I kept being wrong. When you actually run the experiment legitimately, you keep seeing a signal. It's a signal like an outcome, right? That cells are doing something. And you're like, wow, okay, well, and if you do it the right way, if you do it the wrong way, of course it doesn't work, but there's lots of ways to apply PEMF. And just because one of them doesn't work doesn't mean the other ones don't work. I actually calculated one time based on the United States FDA definition of PEMF. Like the simple way to look at it is 11 hertz different from 10 hertz. And according to the FDA, it is, right? And so I called them up, I'm like, okay, is 10.1 hertz different from 11 hertz, right? Well, it's like, how precise do you have to be to have it be something different? Because under the US FDA, if you do something different, it has to be reapproved, right? So then kind of backing the FDA into a corner, I said, okay, so this much of a change constitutes a different thing, something you view as a different thing. And if you then calculate it, I have this on an Excel spreadsheet, there are approximately 1 quadrillion different ways to apply PEMF. That's one with like 15 zeros after it. That's about 200 million times more complicated than chemistry, all of known chemistry in the universe. The number of different chemical species, times about 200 million. That's how many, according to the US FDA, hey, that's a different, 10 is different from 10.1 or whatever it is. And you can slide these values up or down. So my point is, only a narrow range of PEMF works. It's just like if you build a radio and you don't tune it to a station, it's not going to give you a signal back. That does not mean you should conclude that radios in general don't work, right? You have to be doing the right thing with it. Not only do you have to have one that functions, but you got to tune it properly. Yeah. And this gets into the whole issue of the waveform shape and everything like that. But so
we'll touch on each subject, and I think that's quite interesting to know. But while we're in the frequencies, because you mentioned The NASA guys were saying 10 hertz was the magic formula. And you've just said that there's a certain frequency range that you think is more effective. What do you, if you're happy to share that,
I'm totally happy to share that. I've published it, and I'm totally wide open with it, and I've patented it 4 times. So what the guys at NASA said was not that 10 hertz is the magic frequency. What they said, I want to correct you here because then everybody's going to be like, oh, get me a 10 hertz PEMF.
Yeah.
No, that's not what they said. I said, okay, what exactly do you want to test? And the answer was, well, we don't know, but we see different frequencies everywhere in the literature, and we sort of counted them all up and put them into bins. And the most frequent one we saw was 10 hertz. So we think 10 hertz will work. But, is it, so, and then I said, well, I was in the middle of kind of digging through this huge literature. And I said, well, I'm going to go ahead and do this whatever way I think needs to be done. But yeah, okay, I'll take that into account. But the problem with that is that 10 hertz, okay, so there's 2 different ways that we use the word frequency in English, just common English. One of them is, how often does something happen, right? So frequency is thought of as, how many times you have to get up in the middle of the night to go to the restroom, how many clock pulses come out of your clock in your computer. It's a 3.6 gigahertz machine, right? 3.6 gigahertz, but they're square waves, right? However, if you're looking for something like a biological response, it's more likely that you're talking about what's called a frequency content. And so that's what you get with a Fourier transform. It's like if you have a pure sine wave, nice smooth sine wave, it can be one frequency. But if you have a square wave, like a clock pulse on a computer or something, then it contains a bunch of frequencies. Only its main primary frequency is the number of pulses per second. But then it has these things called harmonics, right? And so most people, you can define the first thing that's meant by frequency, which is how often does something happen? How many pulses per second, right? But the thing that probably matters biologically and in many other ways is the signal processing definition of frequency. And the definition of frequency, I haven't run into anybody who knows it. It's like a doctoral level signal processing thing. The definition of frequency is the first time derivative, the rate of change of phase. It's not really how many pulses do you get per second. It's like, it's the first time, it's a calculus thing, right? And it's like, what's the slope, and you sort of figure out what are all the different frequencies that are built into your waveform that's coming out a certain number of times per second. Well, my conclusion, based on the very first 2 experiments we did at NASA, was that it was that second definition of frequency that matters. How the shape of the waveform is, how quickly it's changing, not how many pulses you get per second. So the thing is that when people say frequency to the average person on the street, common English, how many pulses per second. But I did the experiment where we did everything at exactly the same number of pulses per second, 10 pulses per second. But then I changed the waveform, and it only worked for 2 out of the 6 waveforms. We got no biological effect. And we repeated this experiment, got exactly the same results. So that started me down the path of, okay, what matters here is not how many pulses per second, which is, if they don't clarify to you what they're saying, if they just use the word frequency, that's what they mean, pulses per second. And that's how PEMF machines are built. You turn on the coils, you turn them off, turn them on, turn them off. How many times do you turn them on and off every second? That's your frequency. And my argument has been, and there's scientific support for this now because I've tested it, and is that what matters is how quickly it's turned on, how quickly the magnetic field rises, and then how quickly it decays. And that all of a sudden, when I realized that, all of a sudden the light bulb went on, and I was like, oh, Bob, boy, you've really been thick. Okay, so why there's a biological effect now, instead of me just dismissing it out of hand as not even scientific and there's no reason why it should work. All of a sudden you realize, well, the first time derivative, the rate of change in the magnetic field is directly proportional to the induced electric field. This is Faraday's law. This is a well-established. So, it's well-established physics, and it's well-established biology that biological systems, cells, even ones that are not necessarily excitable tissues like nerve and muscle, they respond to electrical fields. And so the connection is the magnetic field changes in such a way that it induces an electric field that the cells can then detect. And cells can detect electric fields in a lot of different ways. But for this to work, you have to induce an electric field of a certain magnitude, and that's your Faraday's equation, right? So it's, you can look it up, but most people, it wouldn't make any sense to them because it's hard to understand. Yeah. And I don't want to simplify it. Everybody keeps saying to me, well, can you give me a simple explanation of it? And it turns out that, YouTube notwithstanding, there are things in the world that just can't be explained easily. Like, if you want to take a person who's working on their PhD in electrical engineering or physics and weed them out and make them cry and drop out, you put them into a class of a course where they have to take electromagnetism. It's really tough. It's like if looking at any course of study you could take at a university, I would say electromagnetism, just understanding it. Oh gosh, all the people that I knew when I was in college, they're like dreading this because it was just so much math and so non-intuitive, so difficult. But if you weed your way through it, the connection is the shape of the pulse, the magnetic pulse, tells you the electric field that you induce. And if you shape that field the right way, you end up with an electric field amplitude, how strong is the field, and a duration. There's old physiology for this that goes back in 1907. It's called chronaxy and rheobase. How long is the pulse and how big is the amplitude? Very old stuff. So this very classical physiology connects to very classical physics, connects to very classical, straightforward electrical engineering. And you can, if you look at it this way, you can see, if I put out a magnetic pulse shaped this way, I can expect to induce an electric field that has these characteristics. And that's the kind of thing that living cells can respond to.
So breaking that down as best I can understand are you saying that the waveform is a little bit more important in terms of the amount of frequency, the frequency we're delivering? So if we're delivering a range between 1 and 30 hertz, which kind of like what I consider, what some other people consider as like your natural frequencies, we could be delivering 1 hertz, we could be delivering 20 hertz, but it's more important for you as to how we deliver them and the waveform that it's delivered through than the frequency. Does that make sense?
Yeah, I would say so. So in my studying this and wrestling with it for the last few decades, I would say probably 85%. I don't think it's one way or the other, like just one exclusive or the other. But I think it's probably 85% that the waveform shape has the biological effect. And then the remaining 15% is how frequently you apply that waveform.
Yeah. Okay.
And it's like, one way to prove to yourself that your physiology responds differently to the same frequency at different waveforms is if you guys are like audio engineers, go ahead and listen to a square wave. Set it for perfect middle C, whatever that is, 258 hertz, right? Listen to a pure sine wave. It sounds very different than a pure square wave, or as close to pure as you can get through an audio filter at the same frequency. You'll hear all these harmonics. It sounds terrible and discordant if you just play a square wave through exactly the same frequency, exactly the same amplitude through your amplifier and your speakers. And that's because your physiology in your ear is responding to the primary frequency, you'll hear the middle C, but then appended onto that is all this other stuff, right? So in your audio physiology, it's primarily going to be the how often is the pulse frequency, because the way your ear works, it's mechanically tuned to mechanically pick out the primary frequencies in your inner ear. And then you can hear these harmonics stacking up on top of it. But that should prove to you that, the waveform has some effect on what you hear, the shape of the waveform, not just the frequency of the signal, like how frequently. And the thing is that, you could assign different values to it. Or you could say, gosh, it doesn't sound at all like a regular sound. That sounds terrible. Or you could say, I can pull the main frequency out of that. I can hear it, but then there's all this other stuff. What percentage, is up to you. But I would say in terms of positive biological benefit, I think it's probably 85% waveform shape and 15% waveform periodicity, depending on the kind of tissue. This depends on the kind of tissue you're talking about. If you want to apply this to your head or your nervous system directly, your nervous system is a little bit more, especially in your head, you can get brainwave entrainment. So the frequency, the periodicity, by periodicity, I mean how often do you get the pulse? Not the shape of the pulse, but how often does the pulse occur? If you're putting something on your head, the periodicity of sound, flashes of light, or magnetic pulses matters, because that will entrain your brain waves to, alpha wave, beta wave, theta wave. So the periodicity becomes more important when you apply PEMF to your head, for example, than it would if you apply it to your leg, where, because there's this overall biological effect. So if the effect that you're shooting for is to reduce inflammation and pain in your leg, you might pick a different periodicity, but you'd want to pick the same waveform. Because it's the waveform itself that seems to have this anti-inflammatory effect. So it's the shape of the wave that does. And then the way that you apply those waves, the periodicity of the waves, has secondary physiologic effects. Like if I was going to apply it to my head, I'd set it for alpha wave. You get the calm awareness as a secondary effect of applying an alpha wave. You're exciting, subthreshold excitation of your neurons with this pulsing magnetic field. And then if your primary effect is to actually reduce inflammation in your head, you're getting that as well. So when people use PEMF on their head, I'm always telling them, think of the two things that you're doing. One of them is this cellular reduction of inflammation. The other one is this network effect of brainwave entrainment, right? That and you can have multiple effects, just like you would with any drug, right? You get the positive effect and you get the side effects, right?
Yeah. And would you prioritize the circadian rhythm when treating the head as well? Because that's something that we look at quite a lot in terms of using much higher frequencies in the morning compared to the evening.
I think that's absolutely true. And that's why I said I would use alpha wave unless it was at night, in which I would probably use, theta or delta, right? Because you're looking to do, neuronal network entrainment. And, there's a whole argument I've argued with neurophysiologists of, which came first, which is the driving frequency and which is the driven frequency. And but I think it's really clear that external influences, even tapping on your head at a certain frequency, different periodicities will matter. And so, I think it's, I've come 180 degrees on this whole PEMF thing, because when I did the science, the answer is there's something really there. And then once I realized, oh gosh, I made a colossal mistake here. Okay, now what matters? And it's like when you apply, the thing, you want to take the whole person into account. It's kind of a holistic thing. Part of it is, there's always this question of, do you apply it for a long period of time every day or just a couple times a week? My argument is the answer is it depends on what gives you the best outcome, right?
Yeah.
I think that the couple times a week for 15 minutes is driven by the clinical expedient that they need to make money on their $40,000 PEMF machine, which means you got to come in during their clinic hours, and they got to line people up and change you over every 15 or 20 minutes. And so it's like a clinical expedient. It sort of works, but then I, do these different things where you could sleep with it at home, on your head or wear it around during the day. I'm wearing one on my back right now. It keeps my back pain down to 0,
Yeah.
I mean,
that's a bit I think people forget about, isn't it? The device we've designed, and same with yours, is putting it under a pillow at night, putting it into the delta frequencies at night and helping deep sleep. Like you mentioned with the brain entrainment, if people are struggling to sleep, or if they want to move their brain into the delta frequencies, then why not influence it with a PEMF device quite close to you?
Well, so this is the thing, and the thing that you'll find out about my take on this whole thing is that, and you had said they're the ones that you guys make, and my opinion is that I've trademarked and patented this largely to protect the market in the United States from people shutting it down. Yeah. I think competition's a good thing. And I look forward to the day when, you got to have a lot of people competing in this market to zero in on what's the best product. And there's people who, like you, focus on sleep stuff. I think you do, right? And I focus more on like chronic pain stuff. And so many people, when I said, the clinicians try to monetize this, there's a dark side and then there's a darker side to this. Okay. So if you spent the $40,000 and you have your $50,000 clinical machine, then you want to line people up, and you tend to fall into the thinking that 2 times or 3 times per week, which maps into Monday, Wednesday, Friday, or Tuesday, Thursday, you come into the clinic, you pay your $100, you get your 15 minutes, and then it's the next person. That's how you monetize it. On the other side of the equation is, if you're not making money on PEMF, I've had 6 or 8 chiropractors tell me this. Oh no, you mean if I use this on my patients, they're not going to come back? Do you know how hard it is to get patients to come in? So you actually run into the problem of, and I've run into this with veterinarians too, because there's some animal diseases that seem to be, I'll use the C word. You can edit it out, curable. There are some animal diseases that are curable, that are terrible diseases, but they make huge amounts because they're chronic end-of-life diseases for animals. Cat kidney disease is a great one. There's others. It's not a great one. It's a terrible one, but it's a great one for making money. But if you can all of a sudden cure it, or treat it so effectively that it doesn't affect the animal's, health span. I don't want to be too cynical, but I think this is really kind of important to say. My whole entry into PEMF is to make it more available and then to raise the integrity of the entire field. And I am fully supportive of anybody making PEMF, that's selling a product that's helping people. And there have been at least 3 major cases where people who would think of themselves as competitors of mine, they'll actually reach out to me and say, well, would you be willing to help us with this? And yeah, sure, of course, because people have been selling PEMF in a way that was very low integrity 20 years ago. And I feel like my biggest contribution was not finding the magic frequency, but actually my biggest contribution was sort of applying good science to it and then bringing integrity to the field and pricing it right. Yeah. Just doesn't have to be outrageously expensive. No. But, the problem with the clinicians that I've dealt with, human as well as veterinarian, is that they're afraid because of the experience that we had. tuberculosis and syphilis, and all of a sudden, whoa, if you cure a disease, you put a lot of people out of work. you know, goodness, right? What happened to all these, sanatoria in the United States where they would deal with tuberculosis, or they had iron lungs or whatever, what happened to these places? They're gone, right? So I tell all of my students, I still actively teach at the university. I've been doing this for 41 years now. What would be the primary follow-on effect of curing cancer? Well, in the United States, every major college campus has a medical school, and the medical school has a cancer building. And everyone in that building and everyone related to that building depends upon the fact that cancer is a persistent disease that we make money off of. And universities build campuses around this kind of research. And so, cynical as it sounds, feel free to cut this out. If you cured cancer, if you went to your kitchen and found a way with Bisquick and make a poultice of Bisquick and ground up herbs and could cure cancer, didn't cost anyone anything. They could just go out in their yard or their larder in their kitchen, figure out the way to cure their own cancer. People would be throwing themselves off the top of buildings at major universities because their career would be over. And I don't think that's an exaggeration. It's like it would be the end of a massive, anybody whose retirement account included, firms that do, oncology and cancer research and drug development, it would just flatten them. So there's a, if you look at the economics, it's like, you see this in energy and food and medicine and all these kinds of things. You could have, if you have a big upset to the way that, if you solve a huge problem that people had been making money off of before with half solutions, and this is, I think, the greatest barrier that I've run into with PEMF in the last 10 years is that there's lots of clinicians who simply won't use it because they're afraid of how well it's going to work. Yeah.
And I echo that. We've had clinics in the UK, I'm not going to name names and it's not all of them at all. Some of them have got the right view on all of this, but some of them we work with, predominantly our device is a home use device. So we've spoken to some of them and they say, right, we come in, we treat them with something, we have something, maybe a high powered device or something like that. Then they take one of these devices home to use at home. And, we've had people selling lots of systems throughout the month and it's working well and the relationship's working well. All of a sudden it drops off a cliff and, we touch base with them. What's going on? Well, these guys are buying these devices and not coming back to see me for their regular massage. And it's like, okay. And why are they not coming back? Well, it seems like they don't need that massage anymore. Okay, so it's a good thing. Right. Well, it's putting me out of business. So, I think this whole selling them to people at home is not working out. So, we see this and we see it happen often. And something else you mentioned, in terms of us talking on this podcast today, effectively we're both manufacturers. We both make our own PEMF devices. And people have said to me, why do you keep inviting on these competitors? And it's exactly like you said, we don't see each other as competitors in this market. A lot of what we're trying to do is raise awareness. A lot of what we're trying to do is get PEMF into homes, for people to benefit from it. So the more people in the market, the better, as far as I'm concerned.
This is exactly the way I feel about it too. Let's look at, let me respond, unpack what you just said, which I think is extremely important. Okay. First of all, we've had similar experiences. It works too well and it's putting people out of business and it scares them. All right. And, the second thing is competition. What are you talking about, man? It's like by far the largest, you're correct. But what I'm saying, other people talking about competition and having to steal market share. I'm like, what are you talking about, man? If you look at the number of people, adults who suffer from chronic pain, it is larger than the next 5 things combined: cancer, stroke and cardiovascular disease and diabetes. And, 1 out of every 3 adults on this planet suffers from chronic pain of some level. And, just because I'm making something that addresses that doesn't mean that I'm taking market share away from some other person doing that. You're talking about a market size of probably, 2 or 3 billion people that need something like this. And so I think what we need is the maximum amount of competition in the market to serve the market properly. And then, hey, if you want to how do you make money on this? Well, what you do is you make a great product that really helps people and you price it right. And anybody who's trying to do that, I'm 100% in their corner. Now, the other thing...
Yeah, go on, sorry.
I was just going to say, the other thing you mentioned was, you send it to these clinics, and a lot of times they'll do this combined work with it, which many people have started with me, but very few people follow through for the reasons that you listed. The best outcomes, a lot of people will ask, well, should you use one or the other? And actually, I think the best outcomes are from both. And I surveyed 421 clinicians a few years ago. If you've ever used PEMF, what gives you the best outcomes? Just using the high-powered ones or using the take-home ones that you use every day, high-powered ones 1, 2, or 3 times a week. And the answer is if you do both, you get the best long-term outcome.
Yeah,
right.
I can't agree anymore.
and there you go. And so if you foolishly help a clinic, I'll use the C word again, cure their people who are coming to them regularly for their adjustments or massage or something. Yeah, their customers don't come back. Within a short period of time of developing this system as a portable wearable device, I stopped going to see my chiropractor. Why? I didn't need it anymore.
Yeah, exactly.
It didn't need it anymore at all. It doesn't really help. And the last few times I went to see him, he was like, boy, your back is really well adjusted. It's not like nothing's really needs to be set back in. And I talked to him about it. And at first he was very excited about that. Well, this would help a lot of people. Then he realized it would mean the end of his clinic really focused on things more like lower back pain and everything. He's like, yeah, this would put me right out of business. So, what's the right thing to do? And I don't want to diminish it too much, but I think that trying to force the world to continue to buy buggy whips when we've all moved on to other types of vehicles, I think that's a disservice, right? But yeah, so anyway, I kind of wanted to say, it looks like you guys and me, or as we'd say down south here, y'all and me, we've converged on the same answer. And it's like, I would say the things I would say about PEMF is that it works extremely well for certain things like chronic pain, so well that it's a threat to the market in many ways. It really is. And as we discover more and more diseases that it can help to alleviate, the more dangerous it is to established cash flows in the gosh, I sound like such a conspiracist, but I think this is just economics, right? It's like if you solved any other big economic problem, then all of a sudden the way that people spend money has to change, right? I mean, look at network television, right? When was the last time you watched network TV?
We were talking about that, it's kind of good to have competitors, more people in this field and that sort of thing. But a good question might be, in your opinion, is there a bad PEMF device? So could there be more people entering into this market with bad products that don't necessarily give PEMF the justice it needs?
That's an awesome question. So let me answer it and then bring me back to this question if I go off on a tangent. I had 38 different companies or individuals contact me to use PEMF for hair growth. Several of them, I don't have problems with hair growth. I'm an older guy, just never lost any hair. So I don't understand that problem. I would be perfectly happy to be bald as long as I didn't have back pain. If I so I don't understand it, but for some people it's very important. But I had 38 companies approach me and they were all extremely low integrity. I had several of them tell me, well, it doesn't even have to work. You just have to flash an LED on and off and people will feel better. And so I wouldn't work with them, right? But I finally found a company. We have a product that's coming out very soon for using PEMF for hair loss. And I can't really talk about it because it hasn't launched yet. But So your question was, could people come off with bad PEMF? Well, one type of bad PEMF is not really caring if it works at all, and just sort of, like the rip-off type thing, just take people's money and run, fly by night. You call it fly by night PEMF. It's something, but you don't know what it is, and they just take your money and they disappear.
Yeah.
The other kind of bad PEMF that could come to market, that is in the market, that I think dominates the market currently, is poorly designed PEMF. And this is one of the things that I was able to do spinning off from my NASA research, was I kept cutting that pulse down, doing what's called in engineering a binary search. Okay, if I cut the pulse, sort of take one half of it, does it still have a biological effect? Yes or no? Look at the other half. Does it still have the biological effect? Yes or no? And then you stick with the part that works. It's like you can play the game with a child, 20 questions. You can carve the universe down to a dandelion in 20 questions by doing a binary search, and saying, okay, is it something that falls into this half of the universe's categorization or this other half? When you cut things in half that way, you can do a tremendous amount of refinement. And that's what I think is missing from most places. What they'll do is they'll have an inefficient pulse, and then in order to get it to work, they turn up the volume. It's like if you had walked through Detroit airport 30 or 40 years ago, the speakers were so bad you couldn't understand them, that they had to keep turning up the volume rather than making the speakers really clear. You walk through a modern airport, we don't have many of those in the United States, but they exist in other countries. They can be very light and you can hear it very clearly, right? Because there's not so much noise. So this kind of comes straight into the issue of your PEMF and why so many people are like, well, how many Gauss can I get? They keep thinking that if they turn up the volume, that'll work better. And my argument is what you do is you cut out the noise, reduce the energy level, and make it work better. So your question of, can people come to the market with bad PEMF? The answer is yeah, by not designing this well, not using the available science, the available information that I freely post on the internet to make it efficient. If you compare the PEMF pulse that I was using with NASA with the subsequent PEMF pulses that we use now, it uses 1/500th of the energy now to get the same biological effect. Is 500 times more efficient, which means I don't have to plug it into the wall anymore. I can power it, with a 9-volt battery. That means you can wear it. You don't have to be plugged into lines anymore. It doesn't have to be 100 watts or 600 watts, because the energy that you need is being put into the signal in a way, enough energy that the signal is efficient at eliciting the biological effect, and all the other stuff has just been removed from the signal. Now you can ask the logical question, does that matter? Economically, sure. You can make PEMF devices. I can just reach over and grab one because I'm working on them, right? You can make them. They're portable. They use like a camcorder battery. Can run the thing. Here's the battery for one of the devices I sell. It's a camcorder battery. Camcorders are kind of running out of style now, so I have to come up with a different battery source for it. But the point is that the whole thing weighs 58 grams. You can put it in your pocket and forget about it because of efficiency.
Yeah.
Right.
So the efficient waveform.
It doesn't need all that extra energy. So that's number one. And then number two is, do you really believe all that extra energy is benign? Is your body really ignoring it? Can you just pile on as much as you want? It doesn't matter. And all your body needs is that 0.2% that it will respond to, and it will ignore the rest. That's an open question, but I'm going to go ahead and speculate that flooding your body with extra energy that has no beneficial biological effect is ill-advised.
Yeah.
It's not a good idea because we don't know. Is it teratogenic if you do this? So here's the problem. If you have these super high-powered PEMFs, and we know that teratogenicity in humans can take, the formation of like a tumor can take 20 or 30 years where we could see the same effect in an animal, which I'm not in favor of animal research, even though just as a scientist, I'm just telling you, we can see an effect in a mouse in a year or two that we wouldn't see in a human for 30 years, right? So if you subject yourself to these overpowered dose of something for, you might not start to see the effects for decades. And so why subject your body to all of this extra energy? So this excellent question of yours is there such a bad thing as bad PEMF? And how does it, is there a risk of it ending up on the market? I would say yes, there is such a thing. It can either be fraudulent or inefficient and overpowered. That's the bad PEMF. And I would say it dominates the market. Any of these super high powered PEMF systems, many of them, I don't know if all of them, because I'm not the police for PEMF, right? But the ones that I've looked at are not very efficient at all. And they put a huge amount of extra energy into your body. Now that's just my opinion. And I'll go on record saying, I've had opinions about PEMF that were completely wrong in the past, starting with NASA. So I could be wrong.
I mean, one we see a lot is, more of a lower powered home use device that we're seeing dominating the market in the UK and the USA and that sort of thing. I shouldn't do, but I call them the Alibaba mats, because you put into PEMF into Alibaba, there's your mat. It's full of crystals, it's full of these red little light bulbs, and it's got all these different things. But what's happening here is PEMF has hit this critical point, which I think, in terms of the awareness is starting to get out there. People are starting to understand it. They're starting to see the benefits. All of a sudden, people want to commercialize this thing. And they're hearing all these benefits. Suddenly they want their product to have PEMF. And there's very cheap, nasty ways of putting PEMF into something. So we're sort of seeing that now. And we're seeing these mats flooding the market with different brands on them. It's all coming from, as far as I'm concerned, the same warehouse in China. They're being marketed very well, but they've cut corners to put PEMF into their mat, as far as I can tell, as far as we can see from a technical mindset of how PEMF works. And, we've just talked about how important the waveform is to get it correct and to get the frequencies correct, to get the best biological response from the body. So now that we're seeing this PEMF being commercialized a lot heavier, we're starting to see these cheaper products kind of flooding the market. And my worry is that these products are going to become so popular that they're in everybody's homes, and then the results aren't really speaking for themselves. All of a sudden, then PEMF goes back under the rug. So, it's up to us to kind of keep raising this awareness of PEMF and the good products out there to get your hands on. This
is so important what you're saying. A lot of people that I know are Chinese, and they were telling me about, 25 years ago, there was a huge surge of interest in PEMF in China. And they were making these $20,000 cost products in China that were PEMF, but it was like exposed correctly as a big scam. And it really put a bad taste in everyone's mouth in China over these things. So they really, for about 10 or 15 years, really looked down on anything related to PEMF. They took it's either all good or all bad kind of track there. And then for 10 or 15 years, fortunately for us, we didn't have a whole lot of Chinese pirates taking everything they could out of every PEMF device and then just flooding the market with these pirated things. That gave us a chance, your group and me, and a chance to get a foothold with something that's good, that works, right? And now they seem to be, as you say, they seem to be coming back around to it. There's a lot of these that have been for decades coming out of Eastern Europe, these very crude ones. Like a lot of what they think are these new PEMF devices are based on really old technologies. Like my favorite one, I knowing nothing about your technology, and I'm going to assume you guys are high integrity. Otherwise you wouldn't be talking to me, because you wouldn't want people to hear the truth. But one of the things that you see advertised a lot especially about 5 or 10 years ago, was they would advertise this new technology, air gap technology, where you have a spark gap, right? Oh, that is about the noisiest way. I mean, that's basically illegal to do because of the amount of radio interference you get. That's pre-vacuum tube, early Nikola Tesla, age technology. There's nothing new or wonderful or secret about that. There's nothing precise about it. If humidity changes, the gap degrades, the frequency changes, the waveform change, all these things. So it's highly imprecise, extremely inefficient, extremely noisy, and extremely old. And yet I saw a flood of these devices back in 2017, 2018, when I was at some meetings. There was like 3 different booths with, you could tell it was exactly the same device, just labeled differently. That was one of those types of devices. And there's like one company in Eastern Europe that just cranks these things out, white label, right? Nothing new about the technology. Now, on the other hand, do these things work? Do they help people? My guess is probably yes. They probably are helpful to a certain extent. They're inefficient, right? So they have all the problems of that terrible inefficiency, noise, saturation in your body that you have. They're way overpriced. These things should cost virtually nothing. There's almost nothing in them. Just the power supply. You'd just be paying for copper, really. Coils of copper. But I wouldn't say they don't work. They work. Yeah. They're just bad in the sense of being overpriced and inefficient and potentially long-term dangerous, but I don't have any proof of that. So it's just a potential thing that I wouldn't do it.
So talking about other products, let's talk about your product. The name of your product is ICES.
ICES. And that actually means something, ICES. And some people think, it ICES like cools and soothes pain. It's inductively coupled electrical stimulation, ICES, because it is my technical belief at this time and subject to change, but it's been pretty strong for the last 15 years or so, that you have this waveform that's the right shape that inductively couples through the Faraday equation, inductive coupling, causing an electric field that cells can respond to, and they tend to respond. If you do it the right way, they respond to these very beneficial ways. And that's that's why I call it ICES. So it's like MicroPulse is my company, ICES. And I can tell you, this is one of the funny things. I know I told you there was 3 companies that have reached out to me for help. And the reason they did this was they're owned by people who actually own and use my device in preference to their $20, $30, $40, $50,000 device. I know of at least 3 that have admitted to me, yours works so well, but they don't want to market it. Right. So they see these take home daily use at home devices as extremely threatening. Because if you could buy something for me for 2 orders of magnitude, less money that has the same beneficial effect, and I don't think they're exactly the same. And I think people benefit from using both of them. But, it's, people use what works. And, like the 2 most popular PEMF systems in the United States, where their system is like the size of luggage, it's got wheels on it, right? I know for a fact, because they have told me that what they and their spouses use, their spouse and their kids and whatever, is my system, because it works really well. But, they sell them for different applications, horses and different things, and, human whole body effects and stuff. And it's a good product, it works. I would say it's inefficient.
Yeah. So I want to give you an analogy that you can tell me if this is, completely off the beaten track, but somebody explained this to me before, and it comes back to the waveform. And trying to explain the slew rate of the waveform, or how it goes up, is important. And when we talk about a sinus wave that's quite a clean wave, and even sometimes you've got the sawtooth, they described it to me as, imagine you're in a car and you're driving at a kind of consistent speed. You don't feel any of that. If you suddenly then accelerated to 30 miles an hour, and then you decelerated, and then you accelerated, then you decelerated, think about what that would do to your body. You know, you can feel the force of the acceleration, the deceleration, acceleration, deceleration. And this analogy kind of stuck with me to kind of explain to other people a little bit more about the importance of the waveform. Does that make sense? I know we're breaking that down really simply.
It does actually, in the sense that the induced, so the change of the magnetic field, the rate at which you change it, it's the rate at which you're changing the magnetic field, not the strength of the magnetic field. It's how quickly you're changing it will induce an electric field. And when you induce an electric field, so I'm going to get a little bit into the theory of what I think is going on here and why I think it's so biologically interesting. So you're inducing this electric field. An electric field exerts physical force on a charge. So anything that's got a positive charge or a negative charge, like, you know, all the proteins in your body and all these transmembrane things in your cells and stuff, they have these charges. And if you put an electrical field there, you're going to apply a force to them. So if it's floating free, you're going to accelerate it. If it's attached to something, you're going to bend it a little bit one way and then the other. So what I think is happening is that applying these fields, these magnetic pulses correctly, it literally jiggles these molecules in a way that is beneficial. It applies forces to these molecules that allows cells to take things in or get things out, or it moves ions in your blood and your lymph that can then be detected by your cells as an important physiologic signal. Like, I think that a lot of what's going on with PEMF is that it emulates normal activity. It causes ionic flow around and within cells, and your cells detect this as activity. And this is sort of like saying, you know, getting up and walking around a little bit is a lot more healthy than lying in bed all day, in the same way that moving these molecules around a little bit with PEMF is a lot more healthy than not. Right. Yeah. I think there's an analogy there. And you know, the thing that trips people up here is the weakness of our educational systems, right? Our Anglophone educational systems, where this is a concept from calculus. This is why calculus is so important. It shows up in economics and engineering and everything. But the concept of, you know, the concept of total energy, which is an integral, that's calculus, right? The rate of change of energy, that's a derivative, that's calculus. And you know, you can look at them as an area, that's your integral, and a slope, that's your derivative. And you know, I think that every college educated person should know this. Okay, I'm a geek, I'm a nerd. I think this stuff is important. But I think it's really important for people, if you want to have an intelligent discussion about these sorts of things, it's something you kind of need to know. And you know, I try to simplify it as much as possible because the math gets really, really hairy. But you know, it's like using your iPhone. You know, try calling up Apple and asking them the inner workings of an iPhone. They'll just hang up on you. You know, and maybe even turn off your phone. You know, why is it that people feel that they should know the inner workings of PEMF? You know, and it's largely because I think that people who have been selling PEMF, they want to pull down a large price for what they're selling. So they want to convince people that they have all this secret science and information that they've built into it, and that, yeah, you're smart enough to understand this. And so it's kind of like this, that's the scam part, is giving people the confidence that they can understand these things really well. You don't have to understand electromagnetism to use an iPhone. You don't have to understand electromagnetism to use PEMF. But if you want to understand an iPhone or understand PEMF, man, you got to do some homework. Yeah. You know, I'm not saying that people aren't smart. What I'm saying is there are some, even the simplest concepts that you need to grasp are calculus, and most people, they, you know, naturally have an aversion to that kind of stuff. So it's not something you can easily understand. And as a result, it becomes subject to fraud. You have people selling somebody, oh, well, I sell this many Gauss, or I sell this much frequency or this special frequency. You know, you can, if you're technically educated and you understand that there's something happening here, you know something about science, you've done the homework. I spent 22 years in college. I paid the price to understand this. Okay. Let me tell you, it was like, and I really did. I had a bunch of degrees, did a bunch of different things. I was a researcher there and everything, but before I got my PhD, it was like 18 years, I think. So yeah, it's just, there's so much room for fraud. There's so much room for misunderstanding because these are extremely complicated things.
Yeah.
And the other part of it is we don't understand the biology. We only, even the extremely complicated things are only the first half of what you need to understand PEMF. The second half is stuff we don't understand. And I personally believe there's at least 2 Nobel Prizes baked into just getting a basic understanding of the actual mechanism that's happening.
Yeah. In this
EMF exposure to cells. So that's kind of where I would leave it.
So just to wrap this one up then, this might be a difficult thing to do, but can you give a couple of things? If somebody wants a PEMF device for their home use and they don't want to do 20 years at college to understand the technology behind it, what are your top 3 things or top couple of things maybe to look for in a PEMF device and maybe a couple of things to avoid in a PEMF device? Is that...
That's a great question. And I'm not just saying that's a great question because I'm being interviewed. That's a really good question because people want stuff that works, right? And it's sort of like, why do you buy an Android device versus an iPhone versus something else? Part of it is personal preference, right? Part of it is your friends and your colleagues will tell you this is really, really great. Part of it is the features, and part of it is, the basic quality and you're willing to spend a certain amount of money. So it's a bunch of factors. I would say that you want to stick with a reputable company. The very first thing I would do is make sure that I've talked to people where they say, yeah, I bought this device from this company. They have great customer service. If it's not working, needs to be fixed. If I want to return it, they're cool about it, right? Because right there, that it's like a real company. They're really trying to do something. So I've been in business with my PEMF stuff now about 15 years, roughly 16 years. And we don't plan on going anywhere. We just keep telling people what we think is the truth. We just keep slowly, persistently trying to improve the value that people get. So I think that our sales are based largely on the integrity play, right? I do that thing on YouTube that's so rare. You just tell people what you really think is true, not try, just and prove it where you can. There's not a lot of, there really was none of that in PEMF 15 years ago. It was so low integrity, but just dealing with a high integrity company, all of the technology stuff aside, because you could use, I would say, integrity as a proxy measure. The company integrity is a proxy measure of effectiveness. Like, is the device likely to be effective? Well, if this is a high integrity company that's been around for a few years, yeah, it's likely to be effective. The next thing I would say is, do they claim that does the company make a lot of claims like, oh, there's 2,000 papers that support our device? If you really want to know, you got to do some homework. You don't have to go to college, but ask them, send me your research. Send me your 2 most important scientific papers, right? Just send them to me. And I've done this a few times with companies, and they're just, they'll send you stuff that when you read, and you have to actually read it, and you read it and you're like, this is nonsense. And I'm not saying at a high scientific standard. I'm saying it like it's just even at a fairly low conversational standard, things that have been sent to me were pretty low quality. Once again, this is using integrity as a proxy for, does the PEMF system you're about to spend your hard-earned money on, does it actually work? So that's what I'd recommend. Deal with it. Deal with a good company, good people who are trying to help you. Then the next thing is, talk to your friends and colleagues. Does it really work? Right? And don't forget, people have this bias where if they just spent $40,000 on a PEMF, they really want to believe it works. So they'll tell you it does. The next thing I would do is, borrow one for a while. Does it work for you? Our devices, on average, they seem to, based on clinician who used hundreds of these on people. And this is what he told me. It takes about 40 minutes for the average person to get relief of back pain using one of our devices. 40 minutes to get noticeable, significant reduction of back pain. Some people take longer, some people take less. But you know what? If you can borrow one from someone without paying money, you can prove it to yourself. Is this something I want to pay? It's like driving a car before you buy it, right? So that's what I would recommend. If you really want to know more about the science, they can join. We have a forum that they can join. It's Flux Health Forum, and you can ask any scientific question you want, and I'll try to figure out what your background is, and I'll give you an answer, and it'll either look like a calculus textbook or it'll look like something I would explain to my grandmother. You know, depending on what you need to hear, you can ask me, and I always respond to 100% of questions. So, you know, Flux Health, one word, .co, not .com, and they can get on our forum. And if you can find any other scientist or engineer who's willing to actually give you an answer about how well their devices work or how their devices work. The third thing I check is when a company reaches out to me, I always say, well, put me in touch with your scientific and technical staff. And about at least half of PEMF companies don't have a scientific or technical staff. They buy these things white label from China or Eastern Europe, and they mark them, and then they market them. So they don't know how they work. So I wouldn't buy anything like that. Yeah. If you can't talk to an engineer or a scientist at the company, I wouldn't spend money there. But that's the way I would do it. Because having an engineer or scientist on staff, that costs a lot. But they'll have 12 marketers, 12 salespeople on staff. You know, then these people get paid commission. They get paid to sell things, not to explain things. So those are the filters that I use.
Yeah, and I think what you just said there is really, really important because, you know, like I mentioned, a lot of the kind of PEMF companies that are coming out now are just very good at marketing and not so good at the technical side of things. And you know, maybe look at some of them companies that are only selling PEMF or maybe one other thing rather than, you know, ice baths, saunas, salt pipes, all these different things. You know, they're just adding PEMF into their collection, you know, as another way of making money. So, thank you for wrapping that up, Bob. Where can people find you? If people want to ask you questions, you mentioned your forum, but is there any way? Obviously, we'll let people leave messages under this podcast, and we'll get in contact with you. But any other way?
The best way is to reach me on the forum. I check the forum once or twice a day. I'm an active participant. We have really excellent community on our forum. We don't advocate any particular product. You guys are welcome to come and talk about your stuff on the forum, and because we talk about PEMF in general. The people on my forum are pretty tuned into identifying and excluding trolls who are just marketers who don't know anything about their products. But yeah, I just try to give truthful information. Other people on the forum, there's a few very, very knowledgeable people. I would say one more thing about PEMF that you just touched upon is that they tend to like add it to a lot of different devices. They're adding it as a feature to try to get people to buy things. But I would say PEMF is actually the best adjunct treatment, if I can say the T word legally. It's the best adjunct treatment that I know of. It seems to make everything else work better, including nutrition and exercise and chiropractic, and everything seems to work better with PEMF because I think it suppresses some of this pathologic, subclinical inflammation. So adding it to a product isn't necessarily a bad thing. It's just, you got to question their motivation. Are they actually trying to make their products better? That's a technical thing. Or are they just trying to make their products sell better? That's a marketing thing. And
the funny thing is when some of these guys, they break out their mat on their device and you've got PEMF at the bottom and then you've got all this stuff on top and you've got even heating mechanisms and all this sort, it's just all gonna get absorbed in that. So that's a big anyway, that's a
really big point. It's like how do you technically combine these things? It matters, like how you put them together, and just the fact that it has lights and heating pads and crystals and PEMF in the product. Well, how are they combined? Are you really getting a synergistic effect? And basically, does the physics even work? Like if you put your PEMF coils, like you say, at the bottom, they're going to be the least effective when they're furthest away from you. So it's a lot of low integrity stuff out there. And I think the trick for your listeners is to identify high integrity organizations, people.
Yeah.
And the quality of the PEMF will just kind of ride along with that.
Follow that.
Yeah.
No, thank you so much, Dr. Robert Dennis. I mean, we could talk for hours, and we probably have to get you back for another podcast because there's plenty of questions I haven't even covered. So
yeah, sure.
We'll get you back for part 2 at some point, but thank you for so much for your time today. It's been incredible, and I think everyone in our audience has learned a lot. So just for our listeners, if you could leave us a 5-star review, if you could like the podcast, share it, then we can offer more guests like Dr. Robert Dennis. So thanks again for joining us today.